Hi there. So I decided to do a video submission for my Reflection 3 assignment on resilience, grief, and burnout. I do have the questions right in front of me. I will be looking down just to look at the questions, but I will be answering the questions to the best of my ability and, of course, to my personal experiences and personal ability to answer the questions. So the first question is, have you ever experienced burnout? Yes, I've experienced burnout. I am in school. I have been for a while, so that's not uncommon for me. If so, what did it feel like and how did you respond to it? So for me, burnout is just a huge amount of stress. It's you're not motivated to do anything. You feel extremely exhausted physically and mentally. Your mood is low. There's a lot of mental conditions that can go along with it, such as depression, anxiety, and panic. For me, it was many panic attacks, especially over the period of COVID, where I've been studying nonstop just to not forget the material I have learned throughout the years, especially since we had that long break, that 7-month break. I didn't want to forget the material, and I was just constantly stressed during that period. How did I respond to it? So the main symptom for me was panic attacks. I was feeling disoriented, heavy breathing, chills, and shakiness. So that was kind of an extreme response as the burnout built up. How did I respond to it? I went to a naturopath for medical healing. I try not to take medical um, medication from a general practitioner. Not that it's bad; it's just my personal opinion. So I went there. They prescribed me some lavender pills, and I listened to a lot of podcasts as well on burnout and on panic. And basically, the logical explanation of burnout and how to deal with it really helped me kind of cope throughout the day and aid in my recovery as well. Also, physical activity helped a lot since it does help with your cortisol levels and induces endorphins and secretes endorphins. So that really helped me. What are your current strategies to help prevent both mental and physical burnout when providing care to palliative care patients? So it's different now because on off campus, we do not have a palliative care facility we go to. We have an online session for palliative care just because of COVID. Um, I can see where people can get mentally and physically burnt out. Mentally, there's a lot of toll because we have to maintain professionalism and that transference and countertransference. We want to limit that. Mentally, it's a lot. You see a lot of patients that are struggling. They're in palliative stage, end of life. So mentally, that does take a toll. Could bring back flashbacks from your previous experiences. Um, Physically, if you're working on a patient constantly and you have a lot of palliative care patients, that can physically burn you out as well. And I feel like mental and physical burnout actually go hand in hand. If you're mentally kind of distraught or mentally tired or burnt out, it actually reflects you physically. So, for example, with me, when I was mentally burnt out with anxiety, panic, I was frequently tired. I wasn't exercising as much, so I feel like my energy was really low. My muscles were super weak, so they kind of go hand in hand. So that's how I can see how the mental and physical burnout can happen in palliative care. Strategies, again, talk to people. For me, when I talk to people about my specific conditions or about my problems, it really helps because I get feedback from somebody else. Physically, work out, keep your body healthy, keep your mind healthy as well. Those are the benefits of exercise. I always kind of preach by those words, and it does really help. Do you feel confident that you have the right strategies and tools correctly in place to prevent burnout? If not, what tools, strategies are you planning to learn and implement? So, yes, I do feel confident with the strategies I've implemented on myself personally. That being said, everyone's really different with how they deal with burnout. For me, I listened to a lot of podcasts again. I worked out a lot. I went to a naturopath. I took the right steps and I took initiative to help myself because the way I was feeling was not very good. And then it was just a vicious cycle of burnout and panic. So the strategies for me helped. However, will these strategies help in palliative care? I'm not sure. Maybe I did not have the experience with palliative care in person, so that's kind of hard to say. If I were to have burnout during this time, if I was actually in the clinic with palliative care patients, I would definitely implement some sort of meditation and podcast. And again, talking with other students, obviously maintaining confidentiality, but how they personally deal with burnout with the situation that we're in. And I definitely think that would help. Of course, you can also read and review articles and learn and implement more strategies of how to deal with burnout, specifically with palliative care patients, since that is a very sensitive topic for some people. Um, Next, managing grief. What do you think the word grief means? So to me, grief means a prolonged period of sadness, usually relating to a certain event that could be traumatic. Personally, for me, grief is temporary. However, that varies individually. So someone has a longer grief period than somebody else, and that's okay. Um, have you ever experienced grief? Yes, I have. My grandmother recently passed away about 2 weeks ago. So for me, that was really tough. But it was even harder for my mom. My grandma lived in Poland. So we would always see her once a year or once every other year. And we would call a lot. So for me, I didn't really have a lot of face-to-face interaction with her. So for me, the grief wasn't as bad. But for my mom, it was really tough. That was her only parent left. She's here and she can't go over there to go to the funeral because of COVID. So that was very hard on her. Instead, we had to do a live funeral visitation where my mom could attend over WhatsApp. So that was really tough. And she is still grieving. Um, and I am slightly as well. But again, practicing those mental strategies can help with the grief as well. That is how I managed it. So again, podcast talking with people really helps, especially with grief, especially with death of a family member. Talking with others helps a lot, and being with family that loves and protects you, that really does help with managing the grief, in my personal opinion. What does the word resilience mean to you? Resilience means to me strength, in specific strength to overcome a certain situation. How can you incorporate resilience into palliative outreach next semester? So again, you have to be pretty strong mentally and physically to go through this certain period of time, because palliative care again is pretty sensitive to some people. So that's how you can incorporate resilience. Again, talk to other people, and yeah, that's what I would say. Just talk to other people and read and talk to your instructors. They're there to help you, and they're there to help you manage through the palliative care outreach for the next semester. They have dealt with grief before. They have dealt with patients and student therapists that weren't very comfortable in that situation. So that that can happen as well, and that can help you out a lot as well. So planning and implementing. How do you plan on preventing burnout, dealing with grief, and being resilient when it comes to treating patients with palliative care? Um, Again, as therapists, showing sympathy as a person, that is fine. But again, we have to be careful with the countertransference and transference. So being in the mindset that you're the therapist and this is the patient, wanting treatment for a specific symptom such as pain, that can kind of help you deal with the grief, because it doesn't really directly, in your mind, it's not directly, oh, you're dealing with somebody with cancer or you're dealing with someone at end of life. So that will help kind of get past that kind of barrier. Preventing burnout, again, I can't stress it enough. Talking to other people, reading about it, podcast, meditation, or working out to kind of help with those endorphins. And being resilient, that sometimes comes with training. Some people are more resilient than others. Some people are just tougher than others mentally and physically and emotionally, and that's okay. So that does take practice. But again, coming in there with a mindset that this person wants a symptom cured, or not necessarily cured, but basically decreased. So they want to decrease the pain. That kind of will help you be resilient, since you're kind of putting your best foot forward as a therapist. What are your strengths and areas for improvement regarding this topic? Areas of improvement for me personally regarding burnout, grief, and resilience. I think personally I'm pretty good with grief. I just feel like I'm emotionally a little bit stronger when it comes to certain situations. Resilience, of course, I do get stressed out with times get a little bit tough, for example, with exams. But again, it's just putting your best foot forward and doing the best that you can as a student of the massage therapy program. Something that I can probably improve on is burnout, since I actually do get burnout very, very frequently. Specifically, kind of in the beginning of the semester when everything's kind of new and fresh, trying to get everything organized, and especially at the end when there's a lot of final Ps, final exams. That for me is very tough. And since I'm getting the burnout frequently and recurrently, I think I have to probably go back and see maybe if there's any other strategies I can use to help with the burnout. So, for example, maybe I can change my podcast to doing meditation. I don't really do a lot of meditation. Maybe I can get more massages myself to kind of help with my anxiety and my stress. And also talking with other people, I would keep up with that. And maybe probably writing a personal journal. I feel like if you have a thought in your mind and it's constantly on your mind, writing it out may potentially help you, because then you can kind of reflect back and set goals on how to help you with that specific thought or symptom that you have. So basically that is my reflection for reflection number 3 for special populations. I hope you enjoyed watching it.